Good morning, good afternoon, good evening to all our attendees, and welcome to the first of two webinars that we will be convening with regards to the Drive DX for TB project. Today's session will focus specifically on the third generation LAM RFP. I'm joined by some fellow colleagues who are involved in the Drive DX for TB project, and they will take over the presentation duties as we move along today's session. To kick us off, I'm going to provide a high-level overview of the Drive DX for TB project, and my colleague, Laure Martin, will take you through the RFP process as outlined on documents available online. Next slide. So the Drive DX for TB project is a newly funded Unitaid project, which aims to accelerate the development, validation, and launch of a simple LAM rapid diagnostic test for use in low and middle income countries. As I indicated, this RFP is funded under the Unitaid Drive DX for TB project and consists of a budget envelope of $15.9 million, which will be used to fund activities that will indirectly support manufacturers in developing evidence dossiers to be submitted to the WHO Global TB Program and the Expert Review Panel for Diagnostics at the Global Fund. Applicants are expected to commit to supplying an affordable product to the public sector in low middle income countries if endorsed through the ERPD or WHO policy review process. Next slide. So just to cover the key characteristics of the product, our expectation for the submissions, you would have seen much of this in the reading that's available online, but essentially we're looking for an ultra-sensitive LAM assay with a superior clinical performance to existing LAM RDTs. We expect that the platform should be suitable for use in decentralized healthcare facilities in low middle income settings, and ultimately should be simple and operated with minimal user training and provide a quick turnaround for results. An important consideration for this test is that it should be affordable in the intended settings. We are expecting to hear from manufacturers with platforms at technology readiness level 4, but essentially we would like to have products that are design locked by Q4 of 2023. In addition, we also need to be aware of the possibility of producing at least 2,000 RDTs by Q4 of 2023. So in terms of the support that will be provided from FIND as part of this RFP, there will be the provision of reagents, as you see indicated on the slide, as well as clinical samples from the FIND biobank. The provision of a reference panel for preclinical testing and manufacturer independent assessment of performance claims will also be provided. We will, in essence, provide manufacturer independent clinical studies in up to 4 low middle income settings with a high burden of TB, including usability assessments and cost effectiveness assessments to meet the requirements for the WHO Global TB Program. In addition, and to support market shaping and access, we will be mapping current and future market dynamics to develop commercialization strategies for the intended settings. We will also provide insights to develop, together with applicants, sustainable commercial models by defining internal value propositions and supporting go-to-market planning. And lastly, collaboration with implementation partners and regional manufacturers based in LMICs to improve access to these products that come through the pipeline. I'm now going to hand over to Laure Martin, who will take you through the RFP process and would also encourage you to add any questions you might have in the chat or the Q&A function that's been enabled for this webinar.
Thank you, Kavi. So taking on from here, I'll be talking through a little bit more details into the actual submission process. So starting with the expected timeline. And I know we already have some questions coming through in the chat. We'll likely be answering them at the end of the presentation. So in terms of the timeline for this RFP, the RFP was released on the 6th of September, and today is the webinar session, which will answer some of your questions. And we have a closing key dates to note, upcoming dates to note are the closing dates for questions is on the 26th of September. And all questions and their answers will be published on the Find Call for Partners website for all applicants to review. And then the closing date for submission is on the 4th of October, as indicated in the RFP documents. There will be 3 stages for the review process, which stage 0, which is focused on the screening of the applications for completeness, for scope and eligibility. That will be completed within October, as well as stage 1 review, which will be conducted by an internal team at Find. I will provide a little bit more detail on the different stages of the review process in a subsequent slide. In the stage 2 review, this will be conducted by external reviewers outside Find, and this will include follow-up questions and live presentations by all shortlisted applicants. During that stage, we will also initiate the due diligence process as per Find's SOPs, and this will be conducted throughout the month of November. And then the final selection will occur in December. And once this is completed, the due diligence process will also be completed, and we can move into contract negotiations with successful applicants from late December to Q1 2023. Next slide. So the selection process has different steps. The key ones that are included in the application that is due on the 4th of October are the assessment criteria and the application presentation. The assessment matrix has 2 components. It includes a technical assessment and a business assessment, which both need to be completed by the applicants. There's also a third sheet, which is termed alignment criteria. This is for reference only and will only be filled out by reviewers, not by applicants. The applicant presentation is a PowerPoint template, which enables providing additional data to the assessment matrix. So these 2 documents will be required at the initial submission time, so by 4th of October. And then for selected applicants that move into the stage 2 review, we will be requesting follow-up presentations. And then following that, another step of the selection process will also be successful completion of the due diligence with Find. Next slide. So this table provides an overview of the content of the different review stages. During stage 0, we will do an initial screening of all the applicants to obtain a set of long-listed candidates. So the criteria that will be used for this stage 0 assessment are verifying that the contents of the application are in scope with the call for partners. So some of the examples of criteria that could be used to determine whether applications are out of scope are detailed in the RFP document. We will also be verifying the eligibility of applicants. At the time of application, we encourage applicants to review the Appendix 1, which contains the Declaration of Undertaking, and verify the eligibility against this declaration. At this time, it's not required to provide a signed declaration, but during the stage 0 process, an eligibility check will be performed by Find. So after stage 0, we will exclude applicants that are not eligible on applications that are out of scope. We will also exclude applications that are not complete. So moving into stage 1, this will be the first evaluation that will be conducted by a review team. We will evaluate all the longlisted candidates by a team of reviewers from FIND. The candidates will be evaluated based on the scores that they obtain on the technical assessment within the assessment matrix, their scores on the business assessment within the assessment matrix, and the applicant presentation. So the internal review panel will score also the candidate's overall alignment within the goals of the RFP. This is the third sheet that is included in the assessment matrix for reference. So at the end of stage 1, we will be shortlisting up to 10 candidates for this RFP before moving into stage 2. During stage 2, the second evaluation will be used to down select the shortlisted candidates to a final list of finalists. So we will be selecting between 3 and 4 successful applicants for the final award. And this will be conducted by an external review panel outside FIND. So the candidates will be evaluated at stage 2 on their scores that were obtained during stage 1 for both the technical and the business assessment. They will also be evaluated based on their applicant presentation and on follow-up questions and live presentations that will be conducted during that stage with the external review panel. The external review panel will have access to the scores that will be completed in stage 1, and they will have access to the applicant presentation. They will be present for the live presentation, and based on these materials, they will be scoring the overall candidate's alignment with the goals of the RFP. So I've provided here a snapshot of the technical assessment just to highlight a few things. The technical assessment it weighs for 25% of the overall applicant score. You can see that there are 2 columns that are highlighted in greenish color, which are to be completed by applicants in the submission. So for each of the requirements criteria, we specify the design requirements, some optimal design specification and acceptable design specification. And in the column titled existing specification, this is where the existing details of the proposed solution need to be described. And then in the second column titled evidence, data supporting claims, this is where evidence and data can be provided to support the existing specification. And if there's not enough space, additional information can also be included in the applicant presentation. So the scores will range from 0 to 3, and you can see in the last column we have provided scoring guidelines to indicate what criteria will be used for the scoring. In the columns in green, we have also provided some in gray, some gray text, some additional information on specific details that would be expected to be provided as part of the supporting evidence and data. I also want to highlight that the weight for each of the criteria is fixed, and 3 indicates a critical or important specification. So the business assessment also weighs for 25% of the overall score. This is also to be completed by the applicant, but there's only 1 column that needs to be completed here, the evidence and supporting information column, which is used to provide supporting evidence for each of the criteria. And again, if there is not enough sufficient space, or if additional information needs to be provided, you may use the applicant presentation to share this information. So I've highlighted in here that a key goal of this RFP is to provide affordable tests to LMICs. So we do urge applicants to provide expected COGS for the assay and, if applicable, instruments, as it is an award condition that manufacturers, developers would commit to a pricing model that is transparent and affordable to LMICs. Another key criteria is the technology, maturity, and time to market. In here, we also want to highlight that another award condition is to demonstrate product readiness for evaluation in a clinical study by Q4 2023. So finally, the third sheet in the assessment matrix is the alignment criteria. This weighs for a total of 50%. Here we are providing some detail on the criteria that will be used by the reviewers, but this does not need to be completed by the applicants. So the applicant presentation, for that, please use the PowerPoint template that was provided to provide any additional context and data to support the claims and to answer all the specific points that are being requested. So the key information to include is detailed in the RFP and in the PowerPoint template. And we would ask you to not go beyond 25 slides, please. So to finish, we would ask any questions to be submitted to the email address shown on the slide. This is so we can coordinate all the responses and then ensure that all the questions and their answers are published on the website for all applicants to view. We will be accepting questions until September 26th. And then the Q&As are already posted, the first version, and we will be revising frequently asked questions on the website up until September 27th. So for the application, we would ask you to submit the completed assessment matrix, applicant presentation, and supporting documents via FIND's Technology Scouting submission web form. The link is provided on the FIND Call for Partners website and in the RFP document. We will only accept complete applications with the completed assessment matrix and application presentation. So that's all for our presentation today. We will take some questions now, and starting with questions that have already been added in the Q&A and the chat. Apologies, I was on mute. So the first question was, does the RFP support near point of care tools or only LAM assays? So you may have seen that as part of the Drive DX for TB project, we have launched 2 RFPs at the same time. So there is a second RFP which will be also conducting in parallel to this one, which is focused on point of care and near point of care molecular diagnostics. But for the specific RFP that we're discussing here today is focused on LAM assays, yes. Is there a separate registration for tomorrow's session? So I think this has already been answered, but yes, there is also a separate registration needed for tomorrow's session. It will be a similar presentation where we go over the application process and the application documents. There are minor differences between the 2 RFPs, so you're welcome to attend the other session tomorrow as well. Our technology, sorry, I'm looking at the remaining questions. Is the RFP open to LAM-based technologies or technologies with performance at par superior to LAM? So this RFP is open to LAM-based technologies. And then the last question, our technology is non-LAM, non-MDX. Are we eligible to apply for these RFPs? So Kevi has answered, the DriveDX for TB project is only accepting RFP submissions for LAM and molecular diagnostic platforms. But you can continue to review ongoing calls for RFPs on the FIME website. So that's 2 new open questions. Please speak about the eligibility criteria a bit. Are universities allowed to participate in this? Also, how do you plan to provide an indirect support with this award? So in terms of the eligibility criteria, at the stage 0 review, we will be performing a sanctions check, which is an evaluation where we review common websites for any sanctions and embargoes against specific organizations. And then further, during the due diligence assessment, we will be doing a deeper assessment of the organization. In addition, you will, as an applicant, you will be asked to also complete the declaration of undertaking that is included in the RFP document. So to answer the second part of the question, which is how we plan to provide indirect support with this award. In essence, for example, when we speak about conducting manufacturer independent clinical evaluations, FIND will be paying for the clinical study. Manufacturers, this will be at no cost to manufacturers, apart from the cost of production of the tests, which will need to be borne by manufacturers, as well as some shipping costs as well. But the actual evaluation will be funded by FIND. And the same is applicable to the other support packages that we have detailed in the previous slide. FIND will be supporting indirectly in that will be paying for this support for successful applicants. How many awardees for this RFP? So we will be awarding between 3 and 6 applications. So I received a new question on the chat. On cost affordability, any guidance on expectations or the cost per test on current lateral flow LAM tests? So the scoring in the RFP will be done. We have not provided a specific guidance on the expected COGS that we want to see, and the scoring will be relative between submissions. And this is because decisions will not be made solely based on price, and there could be an opportunity to achieve future price reduction with adequate volume and COGS optimization. So we have elected not to specify a COGS in the submission documents. So as I wait to see if more questions come up, feel free to also raise your hand and speak directly. So maybe we will give another minute for additional questions, and if not, we will close. So I think this is it for today. Thank you very much for your attendance, and for those also watching the recording online. We look forward to receiving your application by the 4th of October. And feel free to email any remaining questions to the RFP email address. And thank you very much.